Emblem Health. Emblem Health is the umbrella for Emblem GHI, Group Health Incorporated, Emblem HIP Healthcare Partners, and Emblem HIP. This is broken down by plan name as follows. So, how do we know which Emblem plan to choose? Let's look at some cards for clues. This card states GHI Network Access. In Cerner, it is listed as Emblem GHI Network Access and does not run through the eligibility engine. This card clearly states GHI at the top, but it also states the City of New York Health Benefits Program. This makes it the Emblem GHI NYC plan. This is always a split plan. Patients who have this plan have Blue Cross Blue Shield primary to the GHI in regards to the coordination of benefits unless inpatient. At that point, the only insurance listed would be Blue Cross Blue Shield. Blue Cross Blue Shield covers hospital services and GHI covers physicians. On this card, we can see Emblem Health right at the top. It also states HIP Prime HMO in the upper right-hand corner and under Network. Our biggest indicator on this card, however, is this logo at the bottom. Whenever you see this on an insurance card, you need to know this is the Healthcare Partners logo. All of these indicators let us know that this is an Emblem Healthcare Partners HMO. In cases where the eligibility engine or website state Cohort 2, the plan would then be labeled as Emblem HIP HMO POS, although the authorizations are still done through Healthcare Partners. Emblem Health is listed right at the top of this insurance card. We can also see that it says PPO and underwritten by GHI. These indicators show us this is an Emblem GHI PPO EPO, and that is what we would select in Cerner. This insurance card has a lot of clues as to the type of plan it is. We know it's Emblem Health because it states that right at the top. We can also see VIP Essential HMO, Medicare RX, and a CMS number. All of this indicates that this is a Medicare Managed Care plan. In Cerner, you would need to search by the plan alias of U57. Although there is no symbol on the card to indicate Healthcare Partners, we need to select Healthcare Partners Essential VIP. This is the only exception to the rule of searching for the Healthcare Partners logo on the card. It is important to note that HIP Essential plans are the only essential plans that Stony Brook Medicine participates with. This is another Emblem Health plan. We can see the logo, but we can also see VIP Premier HMO, as well as the Medicare RX and the CMS number. This is another Medicare Managed Care. For this one in Cerner, though, we would select Emblem HIP VIP Medicare. The Emblem Health logo is here on the left, but on the right you can see a medal. It says Emblem Health Platinum. The ID number begins with a K, which is your identifier that this is a HIP plan. When you see these, you know that this is automatically a New York State Health Benefit Exchange product through the Affordable Care Act. This is the only exchange product that Stony Brook Medicine participates with. On the bottom of the card, you can also see the Healthcare Partners logo. So in Cerner, you would select Emblem HCP Exchange Healthcare Partners. This is another Emblem Health insurance card that states underwritten by HIP Health Plan of New York. The difference between this card and the last card is that this says HIP MA-R. The ID number is also 3 letters, 5 numbers, and a letter followed by 01. If you remove the first letter and the 01, this is the patient's Medicaid SIN number. This indicates that this plan is a Medicaid Managed Care plan. These plans are primary to Medicaid in the coordination of benefits. In Cerner, we would select Emblem HIP Medicaid. This is a tricky card as it is very similar to the last card reviewed. It again states Emblem Health and is underwritten by HIP Health Plan of New York. It also has the ID number as 3 letters, 5 numbers, and a letter followed by 01. The differences on this card are that it states HIP MA in the upper right-hand corner and has the Healthcare Partner symbol in the bottom left-hand corner. This indicates again that this is a Medicaid Managed Care plan, which is primary to Medicaid in the coordination of benefits. But the difference is that this is a Healthcare Partner product. Therefore, in Cerner, we would select Emblem Healthcare Partners Medicaid. The biggest indicator on this Emblem Health Insurance card is where it says CHP in the upper right-hand corner. This plan is also underwritten by HIP. This indicates that this is a Child Health Plus plan. In Cerner, we would select Emblem HIP CHP as the health plan type. This insurance card has a number of indicators. It states both Emblem Health and GHI and shows GHI Medicare Choice PPO as the network. In the upper right-hand corner of the card, it is telling us that this plan is dual eligible. This tells us that this is a FIDA, fully integrated Duals Advantage plan. This means they have coverage through both Medicaid and Medicare. This insurance is primary, followed with Medicare as secondary and Medicaid as tertiary. Another indicator that this is a FIDA plan is the card shows Medicare RX and both a SIN number and CMS number. In Cerner, you would select Emblem GHI Medicare. Click the X in the upper right-hand corner and continue on to the next module.